All right, today is Hot Topic Day on a new era of dentistry, and what better hot topic than sleep apnea? So many questions about every facet of it are circling about in the ether, if you will, in the office amongst ourselves as peers. So we were lucky enough to be connected with Dr. Dar Radfar, who is a dentist and also owns his own company. You can find him at radhealthinc.com. Would like to introduce him and let Ashley take it from here.
Yes, we're so excited to have you. And first of all, I have to say congratulations on your first place win at Dykema's Dentistry's Got Talent. I know you're fresh coming back from that, so congratulations. So excited for you. Well deserved.
Thank you, Ashley. Thank you, Stephanie. Yeah, it was 18 contestants. We all had a TED talk for about 8 minutes, and they decided to vote me as first place based on my story on what we're going to be talking about today, which is how a dentist like me got into treating thousands of patients to help them sleep better. I mean, sleep is a third of our life. And if we're not doing it well, or if we're doing it poorly, it can actually have tremendous poor effects on your health and on your social well-being. So I'm really excited to share some pearls with the audience today and give them some insight on how to sleep better, and if they're not sleeping well, what to do, and how to be able to fix this problem.
Yes, and I had to say sleep is my favorite activity to do. So happy to have you here. And I know I was able to hear your story at SCN, the Speaking Consulting Network, when you did SOS competition. And I would love for you to just tell the audience a little bit about that story and why sleep apnea is so important to you.
Well, first of all, 5 times higher risk of cancer of any kind if you're not being treated for sleep apnea. 12 to 15 years off your life if you have moderate to severe sleep apnea and you're not being treated for it. And that's life expectancy. That's a disease such as cancer that is very prevalent, and it can spike your possibility of getting it if you have sleep apnea and you're not being treated for it. And sleep is very passionate. I have a very deep dive into sleep because when I was 6 years old and I escaped my country of Iran with horses into the country of Turkey, on the horseback ride, I was told by the person who I was holding, his waist and kind of going through the mountains, don't fall asleep, kid. If you fall asleep, you're going to fall off the horse and die off the mountain cliff. And so sleep has been resonating, let's call it a childhood trauma of mine since I was 6 years old. Don't fall asleep, Dar. Don't fall asleep. Don't fall asleep. If you fall asleep, you're going to die. And fast forward to 2009, at the tender age of 32 years old, I actually, sadly, embarrassingly, fell asleep at the wheel, going 40 miles an hour into a tree, about a block away from my home here in Calabasas, California. And so I've always had sleep issues, but little did I know it wasn't just insomnia. It was actually something called sleep apnea that was making me more tired throughout the day. I started snoring a little bit, especially when I had a couple drinks at night. And we all know someone, or we may be someone that does something like that. And if you're starting to feel a little tired, or someone tells you that you snore, and if you don't have a bed partner, there's an app you can download called Snore Lab. It's free, to see, hey, like, let's hear yourself. What's going on? And at the end of the day, that kind of pushed me to dive into this because I almost died from it, and got myself a home sleep test. And the rest was history. I treated myself with an oral appliance. I couldn't wear that mask called the CPAP machine, nor was it. It's kind of embarrassing for most people to put that on next to a bed partner, even if you're married. And so that's been my journey. I also have my son, who's 15 now. A few months after my car accident in '09, 2.5-year-old son, he's snoring, and he was grumpy throughout the day. So my son, we had him evaluated by a pediatric ENT. It's kind of things like, why do these things happen in my life, and why do things happen in your life, right? There's people who are listening. There's certain things that source or God or whoever you believe in kind of puts in front of you to see. Maybe you can learn from it, right? A lesson learned in a hard situation to be able to hopefully give and provide in the best way possible. So my son went through pediatric surgery to remove his tonsils and adenoids, and completely changed his mood in the mornings, and his growth spurt went from 30th percent to 70th in 1 year. And so I've got a real big heart and passion for this stuff called sleep, and I'm looking forward to diving in and talking about some of the details here.
Wow. I mean, like I said, you have an amazing story, and with your son, even that, it's affected his sleep. And coincidentally enough, my son this week is getting his tonsils and adenoids out. My 7-year-old, because he's a snorer, he grinds down his teeth. He has, diagnosed with ADHD. So I feel like it's sleep apnea it's so prevalent, and it's something that is so missed or potentially even misdiagnosed with other issues that are going on. So, as a dentist, what are the signs you look for? And how can you help your patients to help them understand, hey, you might have sleep apnea?
Yeah, so this is what I teach in my courses. My radseminar.com is my website for my coaches, for dentists to learn how to do this. Because when I was talking to USC, where I went to dental school few months ago, back in May, to the graduating class, I was teaching them about this for about just an hour. And it's crazy. Even the graduating class has no idea what to look for in the mouth when it comes to sleep apnea. And most people that are not dentists or in the medical field, what are you supposed to look for? And it's kind of the same things. I always teach, look for lower front teeth that are worn down, grinding of your lower front teeth, because you're grinding your teeth, your jaw forward, creating almost like that CPR airway opening, bringing your lower jaw forward, getting the tongue that's attached to your lower jaw away from the back of the throat. So grinding of your teeth is especially lower front teeth wear or chipping is one of the tail signs. Another one is the scalloping of your tongue. So the side of the tongue usually has some ridges. It looks like indentations because you thrust your tongue forward against the back of your teeth every single time you have an apneic event at night. And so that thrusting of the tongue going forward, hitting the back of the teeth where the floss goes in between the teeth there, those striations occur because it gets pierced in the back of the teeth there. So those are some things that anyone can look in the mirror and see what's going on in the mouth. Dry mouth in the morning, mouth breathing is a big indication. And really having too narrow of a jaw. I mean, that's kind of hard to tell for some of the people who aren't in the dental field, but the wider the jaw is, the better. That's why I'm such a big advocate pushing phase 1 orthodontics, which is orthodontics between the ages of 5 and 12, where you can expand the jaw or correct the jaw that's further back. We call it retruded jaw, where you have a really big overbite. And so these are all tail signs of, hey, maybe we should interceptively do some orthodontics, not braces necessarily, because the adult teeth aren't all in, but expanders and correction of the lower jaw coming forward, so you can get more room for the tongue to be away from that back of the throat, which causes the sleep apnea and the snoring. And so those are some of the things to look for in the mouth, or even the face, when you talk about the chin being further back, again, retruded compared to the upper lip, for example. The other things are just, feeling more tired throughout the day, someone telling you that you snore. There's some medical implications like high blood pressure, acid reflux, heart arrhythmias, diabetes type 2, memory loss, depression, anxiety, mental health. You mentioned ADHD for kids. Your mind's racing and it's never calm because it's always in a fight or flight response while we sleep. And that's not okay. We need to be in that relaxed, breathing in oxygen to get nitric oxide production to relax us, kind of like similar in yoga or meditation breathing. Breathe deep through your nose and exhale. That produces nitric oxide, which helps us calm and not have the hyperactive or anxiety filled kind of day. So, big word, mental health, the words, right? Mental health. It's reported 46% of depressed patients are because of not getting enough oxygen at night. So their serotonin levels are depleted. So almost half of patients who are depressed or on medication, if we can check their sleep with a sleep study, the home sleep study now, a really easy something to do that a dentist that can refer you or a medical doctor can refer you, we can probably help them sleep better and then wake up in the morning and feeling more happy, right? Who doesn't want to be more happy without medications and without therapy and all these other things that we do, right? And it could be the ticket is checking out and evaluating your sleep.
Wow. So many things. And why do you think this topic necessarily hasn't been talked about much in dentistry? Because I feel like dentists are going to be the ones that find the issue with, or at least see the signs of sleep apnea. Why do you think that this is a topic that, I feel like now it's getting out more and more how important sleep is? But why do we think that is? Why do we think it's newer information in the field?
Right. So since 2010, so the oral appliance has been, and I have mine right here that I religiously wear. I wore it last night. So the oral appliance has been put on the map as treatment by the American Medical Association, not even Dental Association, for the treatment of sleep apnea. So I jumped at the opportunity in 2010 and made myself a mouthpiece. Fast forward later, I've made a few thousand of them for patients. And really, the dentist is the one that sees you every 3, 4, or 6 months. They look in your mouth, which is where the airway is, right? And we talked about those tail signs of dry mouth and grinding of your lower front teeth and the scalloping or striations on the side of the tongue. And there's other things that are a little bit more technical that dentists can look at in the mouth that I go over in my courses. But really, the medical doctors are treating conditions. They're not necessarily doing a wellness preventative program. Not all of them. There's a bunch of programs out there that are preventative, so to speak. But primary care physicians, internal medicine, they're not looking in the mouth going, hey, how well do you sleep at night? I noticed striations on your tongue or lower anterior wear. That's not a conversation. I've had dozens and dozens of conversations with medical physicians from different genres of medicine. I mentioned 5 times higher risk of cancer of any kind if you're not treated for sleep apnea. Why isn't every single oncologist referring the patient once they got a diagnosis for cancer for sleep apnea so that in remission the cancer doesn't come back? 48% of diabetic patients, type 2 diabetes. Why aren't endocrinologists not doing sleep studies on anyone who has a diabetic or possible pre-diabetic, almost diabetic diagnosis? It's because they're hyper-focused on their specialty. And pulmonary physicians, sleep doctors, sleep physicians, are the ones who evaluate your sleep. So unless a person brings up the problem, hi, Dr. Cardiologist, my arrhythmias have been happening. And then the cardiologist is going to be like, how well do you sleep? They're not going to just go towards the screening for sleep by asking the patient, how do you sleep at night? Does anyone tell you that you snore? Do you feel tired throughout the day? Do you wake up in the middle of the night to go to the restroom more than once? These are, again, some of the things that MDs will ask you if the patient themselves brings up the problem or the problem's already there, right? High blood pressure, arrhythmias, acid reflux, cancer diagnosis. And then maybe they'll ask you, hey, do you have sleep issues? But not every physician is let's call it screening, let alone diagnosing, because the diagnosis is done by a board certified sleep physician. I don't do the diagnosis. I refer a patient for a home sleep test. The results come back once the patient does it, signed off by a board certified sleep physician. Then we decide on the treatment. And so MDs, I hope that they start becoming proactive in this screening by at least providing a form on their consult visit that is associated with any of their diseases that they're helping the patient with, especially if it has a correlation with sleep apnea.
And it's interesting, you talked about the home study. In my head, when I think of a sleep test, I think of the one that, I had to get done, which was at a hospital, all these million cords hooked up to you. It's, very expensive to get it done, but you can do it at home. Like, it doesn't have to be this difficult challenge to go get a sleep test done at a hospital.
Yeah, the cash fee is about $245 for most home sleep testing companies. You do need a referral. They do bill medical insurance for you. Deductibles apply. You do need a referral from a dentist. There's only a couple states in the country that don't allow dental referrals. You got to go through an MD, or any MD can refer you for the home sleep test. If they're not doing it, they can refer you to a sleep physician, right? You can just literally Google sleep physician or ask your dentist if they've been trained by
Mhm.
rad seminars, maybe they're done. I've trained over a few thousand dentists already. So the referral's made. They send you the equipment. It's super easy to wear. It has a pulse ox. It measures your breathing, and it's a legitimate study to check to see if you have sleep apnea and snoring. It actually tells you a lot of details about your sleep. Now, if you're sleepwalking, if you have restless leg syndrome or any sort of other non-breathing issues, you do need to go into a sleep lab and be hooked up to like 50 monitors and go through that process. But restless leg syndrome, and not to discount those and sleepwalking, are not 5 times higher risk of cancer, or not 12 to 15 years off your life, or not increasing your chances of heart attack and stroke and depression, and annoying your bed partner. Let's not forget the social part of it, which I'd love to dive into when you're ready.
Yeah, let's get into it. Let's talk about that.
Hey, let me give you a scenario. You're married and your partner wears earplugs, is a heavy sleeper, sleeps in the other bedroom, right? Some of these things are happening between married couples. And then sadly, you become part of a statistic that over 50% people get divorced. And now you're dating again, right? And you become intimate with someone, and now they hear you for the first time. This isn't something that they're going to sign up for, right? And wearing a mask called the CPAP machine, continuous positive airway pressure, putting that on the first encounter is a little bit embarrassing, right? And so the mouthpiece is like so much easier and more night guard looking, right? A little bit more discreet, that over 80% of patients out there who have this problem can be treated with an appliance. Yeah, there's 20% of patients that are super severe and they should really try the CPAP. And if they don't tolerate the CPAP, you can still do an oral appliance and see how much it helps. But really, the social well-being, going on a camping trip, sleeping, there's business conferences that people go to and they share a room, right? On a cruise. I mean, there's so many sleepover situations, even as an adult, that happen, that it's really embarrassing. Girls trip, boys trip, and especially there's alcohol involved, which makes the snoring and apnea worse because it dries the mouth and relaxes the tongue even more. So, um, there is a emotional social problem here, and it's embarrassing. And you're subconscious and you're like, oh man, I'm going to be sleeping next to so and so tonight. That's going to be embarrassing. And so you try to prop your pillows up. You try to not drink too late. Drink a little more water. I mean, the solution is home sleep test. Let's figure it out. Have a dentist that's qualified, make you an oral appliance or a CPAP machine. And let alone all the medical things that we talked about. So it's really important. There's a social well-being here that people are really, really hurting and embarrassed, and there's a solution.
It sounds to me like it would serve patients the most in dentistry to make sure that all offices have sleep habit questions on their health history and intake forms, which in, my 30 years, I don't think is a very common thing unless it's changed much recently.
Yeah, I teach all my office, my clients to have a sleep questionnaire for all new patients, because that's form number 4 that they fill out. Are the patients truthful in a dental practice if they saw that questionnaire relative to a cardiology office? Not always. So for the dentists or dental hygienists or that team out there, don't just believe whatever that form that's being, there's stop bang is a form. There's sleep Epworth questionnaire that asks you, like, do you snore? Do you feel tired throughout the day? Have you ever fallen asleep at the wheel? Like I have. These types of questions can open up the conversation with, hey man, so I see here that you check mark that you snore, John. How well do you sleep? Have you ever had a sleep study? Boom, that's the conversation, right? Now, if it's existing patient, I've had forms given to existing patient. They're on a clipboard. They're coming in for a checkup, cleaning, or a crown prep, or something that's non sleep related, and they're like, what's Dr. Rad trying to do with this? Is he trying to pay off his Aston Martin today? Is this for his vacation to Italy that he went with his daughter last week? You get those sly pushback remarks because we are in a close relationship with our patients. They're not just seeing us one time and that's it for most dentists, right? It's a relationship that they feel they could have these sly remarks, this is how he drives that car, and it's like, No, bro, no, sweetie, that's not the reason. I'm trying to save your life here. So I do like to have the conversation for an existing patient to happen in the operatory. That's where the hygienist, and I've created like a 25-minute video in my program for hygienists and assistants to look at the people who first look in the mouth and take orthoral photos, like what to look for, the signs that we were talking about: grinding of teeth, narrow arches, retreated jaw, arched scallop tongue, all those things. And then just say, how well do you sleep at night? I sleep like crap. Oh, let me have Dr. Rad talk to you. We can help you at the office. He's trained in dentist trained in sleep. Yeah, there's actually a mouthpiece now. You don't have to wear a mask. Most patients who can't tolerate the CPAP can wear a mouthpiece, and it's effective. I'll have Dr. Rad talk to you about it. And that's the conversation that could be brought up in every hygiene appointment. You're cleaning, you're polishing the teeth. Those hygienists out there, and the tongue is covering the molars, and or you're drilling a tooth and the tongue's in the way. It's so large. I mean, you don't tell them, hey, patient, why do you have such a big tongue? How'd you get your tongue to be that big? No, you just kind of say, I was looking back at your airway when I had you back. I noticed that it looked a little restricted. I'm worried that you're not getting enough oxygen when you sleep. Does anyone tell you that you snore? I don't sleep next to anyone. Okay. Do you have a bed? Do you feel tired throughout the day? Do you wake up gasping for air? Your heart racing? Do you grind your teeth at night? Right. And if any of those are yes, you can jump into the conversation. My favorite is the patient sitting in the chair. They're literally making these snort sounds because they sound like they could definitely be snoring if they're awake and breathing heavily. And they go, no, Dr. Rad, everything's totally fine. I sleep like a baby. First of all, most babies don't sleep well. They wake up every 3 hours last time I checked. But once they do finally fall asleep, maybe, yeah. But they'll remember that conversation. 6 months later, they'll be in the chair. They'd be like, Dr. Rad, yeah, my wife's, complaining about my snoring. And I remember you talked to me about that 6 months ago when I gave you an egotistical response that everything was fine. It's not fine. What do I do about that? So plant the seed. Send your emails that, Dr. Rad is now doing screening for snoring and sleep apnea. Please come in for a complimentary consult if this is affecting you or anyone in your family or anyone in your circle. Send an email. Talk about the 5 times higher risk of cancer. This is why it's so important that we look at it in your next visit. Bring it up and send the SMS message, possibly, if you guys do that with respect to marketing. And educate your patients about it before they even come into the operatory, through email, through SMS, once a month. Do a quick little, throw it into ChatGPT. I mean, correlations of dentistry and sleep apnea. Copy paste, put it on your email format, and send it through Dental Intel or whoever you guys use. So it's super easy to communicate this once you've been trained on how to do it.
Well, and as you're speaking, I wonder, do you feel like with sleep apnea, different generations will accept the news differently? Because I'm thinking, my father's generation, he is on the CPAP. Traveling with him was always an adventure, making sure you had an outlet, distilled water, filtered water to do it. So definitely understand that. And then my mom, who has sleep apnea but refuses to get it checked. We've known forever, but she just refuses. Do you think potentially younger generations might be more proactive about, hey, I might have an issue, let me get that checked? Where sleep apnea, it might even, a trend of people understanding their sleep apnea might actually increase as dentists start talking about it more, because maybe the younger generation might be more proactive to go get it, checked out, instead of just, burying maybe their head in the sand a bit, like my mom.
So Ashley and Stephanie, the huge marker here is, why would I get tested for sleep as a person? Why? Why do I want to know? What's the point? I'm okay. Yeah, sometimes I'm, tired and sometimes I'm grumpy, but that's just me and that's my life and my personality and all that fun stuff. There has to be an emotional component attached to the reason why we do this. The emotional component is not, I want to lower my blood pressure. It's not, I want to, sleep next to my bed partner. Maybe it is. Maybe that's a social emotional, but it really is to have more energy for yourself throughout the day. It's just to be a happier human being. It's to have energy for your loved ones, for your grandkids and your kids. It's to not be so rebutting and combative with your partner. It's to be more focused at work so you can make more money. Health, wealth, and relationships are severely affected by poor sleep. Your health, we talked about, your wealth. I mean, it's amazing how much your focus at work can be better when you got good sleep. Like try pulling sleeping 2-3 hours, 4 hours at night, and then going to work and figuring out numbers and emails and dealing with your coworkers and all that. Don't you want to be more happy? I mean, if you just want to be more happy, get it tested out. If you're just sitting in this misery, there's an emotional component that you're suffering from, and that could be hopefully the motivating factor, is that getting that energy just to be with your family and your love. Like with your mom, if she saw an email from her dentist that said 12 to 15 years off your life, we care about our patients. If not to put fear mongering in, but because of this statistic, if we want to be around with our grandkids more and be around for our families in a healthier state of being, till our last breath, pun intended, it behooves us to have this checked out. Come into Dr. Rad's office. You can make it emotional. People will read that, and they'll maybe not the first time, but maybe the 11th time that they get that email in the next 6 months or so, that keeps hitting them with different bullet points of medical and emotional well-being. You eventually will hopefully have the patient agree to a sleep study and treatment.
And like you said, they see you, a dentist, often, so it's almost also taking out the barrier of, oh, I need to go call my doctor, get that whole sleep study. Like it makes it very easy when the dentist is the one that you already see them often. They're the one that's getting you the referral. You're doing the sleep test at home if you can, and I'm sure, following up with the dentist. I would love to hear more about the teaching course that you provide. How do you equip dentists to be able to provide this service to their patients?
So I've been training dentists since 2014. They come to my weekend course, and then 90% of them go on Monday and don't do a thing. I mean, you have the power as a human being called a dentist to be able to add years to someone's life. With all the respect to all the other things I do in dentistry, that doesn't necessarily add years. Yes, perio cleaning, keeping their gums healthy leads to heart health. Placing an implant for $4,000 with the crown and post, doing Invisalign for anywhere from $4,000 to $7,000. These are all beautiful things in dentistry that we do that are very, very important in chewing and heart health, let alone making teeth look pretty and have confidence and all that. But sleep apnea is a direct health and also social implication. And so dentists who get trained by me, really, I've figured out, will succeed if afterwards I'm doing one-on-one calls with them, 30-minute calls every week to make sure that as a coach, I'm supporting their studies and what they've learned, and I'm pushing them and making sure that they and their staff are screening patients every day. 30% of the population has sleep apnea in America. So when you have 20 patients walking in for all sorts of things, let's say 8 hygiene and 12 treatment, new patient, fist check, night guard, whatever it is, out of the 26 have sleep apnea. So you got 6 people coming in and out on an average basis of a 20 patient day, and no one's saying anything. No one's bringing it up. No one's giving a form. And so that's what I teach, is how to implement this into a dental practice. The dentistry in making this appliance is a joke. I mean, sealants are more challenging. Deep cleanings are more challenging. This is like a scan or impressions of your upper and lower, and there's a jig that you place for the bite, and you just scan or take a bite of that. You send it to the lab, and about 2 to 3 weeks later, you have the appliance. You put it in, make sure it's not too tight or too loose. I mean, it's super easy to adjust. They go home and they come back after a week and they tell you, hey, doc, I love you. My wife loves you. My husband loves you. Or, hey, it's 50% better, because I ask him, How's the snoring? Do you get up at that? How much energy do you have? Do you feel more happier throughout the day? Do you get up to go pee at all? Are you dreaming more? All these things are positive attributes of this little guy called the oral appliance. And so if they're not, I adjust the appliance another whole millimeter forward, bringing the jaw more forward, and we do that incrementally, millimeter at a time. So I teach all this stuff on how to do it. It's not the dentistry that's, let's say, hard to implement. That's like the easiest. It's the consistency of screening, knowing which home sleep study to refer to, and also, or company to refer to. And also, if you want to dive into the medical billing world, which medical billing company to use, because I highly recommend to outsource your billing. Most people through you guys are doing their dental billing through you. The medical billing is something definitely you don't want to put the burden on your staff. They're going to be like, what? What is this? Why? And then it was only a 3 or 4 codes to bill anyway, office visits and an appliance. But forget about the billing for medical. Just forget about it. Would you charge $3,000 for an appliance? If you're charging $4,000 for an implant, post, and crown, $5,000 for Invisalign, you're charging anywhere from $900 if you're part of a Delta PPO is like $780 something, right? Something like that. It's embarrassing. It hasn't changed since like 1980. And I'm being sarcastic, of course. Or up to like $2,200. Some people are charging for 1 crown. On an average cash patient is about $3,000 for an appliance. That's what I recommend. Some people are charging more than that to save the patient's life by adding more years, to help them sleep next to someone. They've had a sleep study and they failed their CPAP in a lab at home. You recommend it for a sleep study. They're sleeping next to someone who hears them gasping for air. They are more likely to check mark on the treatment plan when you offer them a $3,000 cash oral appliance. Just go cash. Don't let medical insurance be the hindrance why you don't help these humans that only a dentist can help if they're not going to wear that mask. So that's what radseminar.com has. My courses all kind of talk about those little details. And of course, the comprehensive coaching program, anyone can reach me through the website if they're interested in learning on how to do this.
Amazing. And I would love our listeners to know how, what is the best way to get in touch with you? Is it through your website, email, phone? I know we're going to have a lot of people that are going to want to reach out, learn more. It is, like I said, every dental office should be screening for this. And if you're not, I want them to reach out to you. So what is the best way to get a hold of you?
So I'm kind of one of those people that on my iPhone, there's very few numbers. Like I have like 1 email unread, 1 text message.
Teach me your ways.
God bless the people who have 14,872 emails and 276 group messages that haven't been read yet. I am not that human. If I have a break between patients, if I'm talking to my kid and they're doing something, I have a little second, I'll open the email or my text. So best way to probably communicate with me is through my email. My first name, last name is darradfar@gmail.com. Or you could go to radseminar.com and just send go in the chat or send a note to that you want to talk to me about being trained. That's probably the best. I also have my Instagram and Facebook as well, Dar Radfar for Facebook, and Dr. Dr. Rad Health for Instagram. I also don't let the DMs go unnoticed as well. A little OCD about those things. So you can reach me through those avenues.
Amazing. We'll make sure to put all those details in the show notes too, so that any listeners, please reach out. Again, this is something that our offices can be catching for our patients. And I just want to thank you so much for coming on, for talking about it, for telling us about your story. I mean, you do have such an unbelievable story. I know our listeners would love to just dive in more and hear more. Will you be speaking at any events coming up?
Yeah, so I recently just spoke in Denver at the Dykema DSO conference, and I was blessed. Out of 18 contestants, I got first place for my story. One of the biggest things I wanted to just lead with is we all have some sort of childhood trauma. Some of us are, worse than others. And when you play in victim and fear mode and haven't worked on that, it does really prevent the universe from bringing really beautiful things into our lives. And even if you have worked on it, the way we push through the things that the universe that brings us is not okay and not fun is a little easier when you lead with a little bit more of a compassionate and love mindset. And there's an energy of fear and victim, and then there's an energy of love and compassion. And as dental professionals, when we lead with that, when we're talking about sleep, patients will really listen to you, and they may throw a sly remark about how you're trying to sell them something to, for your car payment or your next vacation. Stay focused. My next talk is going to be at the Dental Festival in Key West, Florida. I'm also competing in that as well. There's 30 contestants, dentists and hygienists and coaches and consultants that are speaking. It's September 10th through the 12th, the Dental Festival, thedentalfestival.com. If anybody wants to go, it's a great networking event put together by Elijah Desmond. He does a wonderful job. He's done some beautiful things in the dental community to bring people together. And for any dentist out there that really wants to make money off of this, and I do talk about that. We talked a little bit about heart and giving and saving and all that. On the average, the offices that I train make about $210,000 a year extra to their collections the first year. And I guarantee whatever that they pay me, they get in return. And so 210,000 collections, if you times it by your famous new fun word called EBITDA, and go at a 3 to 5 or 10x, that's $1 million+ that you're adding to your practice's well-being. So if money is a motivating factor for some of the dentists out there to do better and need more and pay their bills and their hygienists and their staff and take care of their families, and I'd love to help dentists out there to be able to take care of their families in any capacity possible. So treating sleep is definitely one of them.
Yeah. And your compassion, your love definitely shines through for what you do. So thank you for what you are doing in dentistry. Thank you for getting the message out. Thank you for helping our offices and our dentists. And again, we'll have all your information in the show notes. So we just want to thank you so much for being on the podcast. And we'll chat with all of you all next week. Thank you so much, Dr. Rad. And
thank you, Ashley, and thank you, Stephanie, and great job at Wisdom. You guys are doing great with the billing. Keep it up.
Amazing.
Love it.
Thank you so much.
Thanks for everyone for listening.
Good to see you. Bye.